Hi, Dr. Sean back again. We are going through the Healing Vibe book that I just wrote. And today we're talking about the stomach. Jeez. The stomach is probably the biggest interface, besides the mesentery we talked about earlier, the biggest interface between getting people well and not getting them well. I probably fix more stomachs on my patients than any other organ of the body. The gallbladder is probably a close second. But the stomach becomes critical because it's literally where you take the food that you eat and you melt it into a pulp, a liquid called chyme. We talked earlier about the mesentery absorbing food into the body, which has to become 1,000,000 times smaller than you are to absorb through the little villi and the little openings in the large and small intestine. We'll get later into leaky gut because that's how leaky gut begins, is that when you don't finish digestion in the stomach and the stomach doesn't do its job, you will create a leaky gut because food sits there too long and big food particles get in the body, and that causes a whole host of problems that can cause hundreds of different syndromes. So fixing the stomach becomes critical to your health. And here's a little picture of the stomach. So when we talked the other day about your mouth and your teeth, you got your esophagus, and this is where the stomach is. This is where the stomach is coming in. And here's a good picture of it. The big thing to understand about the stomach is it's a big bag. And it's got 3 layers of muscles that kind of overlap one another. They crisscross, and they churn your food, and it twists and it turns, and you don't even feel this half of the time. And that is where digestion is really taking place. It's taking meats and these heavy-duty foods that we're eating and really turns them into this nice, good chyme that gets ready for digestion in the small intestine, which becomes next. Now, the biggest thing that you find in the stomach is it gets knotted up. It literally has knots in it. And I talk extensively how having knots in your stomach is the same thing as anxiety. So I'm always talking about in my book about how emotions are driving our health, and when you are experiencing lots of anxiety and not necessarily fear, that becomes another organ. Anxiety is the biggest one, and stress. Your stomach literally becomes a knot. And when it becomes a knot, you knock down digestion all over the place. And it's very common for people to take over-the-counter Tums and antacids, which are fine for the time being. The biggest problem is when people start taking H2 blockers and they take hydrochloric acid blockers, and they just knock digestion down completely, which although it may prevent acid reflux and can help ulcers heal because you stop hydrochloric acid, ultimately that is not the fix. Ultimately that leads to deeper problems for the body, because if you don't digest food properly, you're going to run into many problems that you don't even think are closely linked to the stomach. So we talked earlier about the mouth and the teeth, chewing your food properly, getting the food properly presented to the stomach, and then getting into the stomach so the stomach can do its job. Now, when I help people heal stomachs, many times I'm giving them the same things that their stomach should be doing, which it has stopped doing. There is ammonium chloride, there's hydrochloric acid, there's things like ochrapepsin, which soothe and heal, there's digestive salts, potassium chloride is a great one. There's very simple things that I give the stomach to start the process of digestion and slowly train the stomach to do what's on its own again. So thinking of stomach digestion is probably the most important you should be thinking about when you want to restore your health. Even if you're dealing with things like constipation or chronic diarrhea, even if you have things like diverticulitis, other problems that you see lower in the GI tract, most often I see are happening because the stomach has stopped doing its job. So the next thing we're going to talk about is the gallbladder, because he is next in line. Because if the stomach comes down, the food starts entering the small intestine, but that's critical where the biliary ducts and your pancreas is helping out in putting their digestive juices into the digestive system. So stay tuned. We're going to talk about the gallbladder next.